Good morning. I've got a bit of a cold, so if my voice starts going, the speech might be really short this morning. Good morning, delegates and guests, and welcome to the SMA's Fall Representative Assembly. It's great to see so many colleagues here, many people I know, some new faces that I haven't met before, but it's great that everybody's here and dedicated to futuring our profession. When I became the president of the SMA at the MARA, I made it my mission to engage you, our membership. I think it's vitally important that Saskatchewan's physicians are engaged, not just with the SMA, but with their regional medical associations, their sections, their regions, and the healthcare system in general. Without continual engagement on many levels, the ability of Saskatchewan's physicians to influence the healthcare system and drive innovation will be diminished. We have many groups trying to influence how the system will evolve and grow. And if we are to remain the leaders and drivers of patient care and innovation, we must ensure that our voices are heard. The SMA has been increasing our efforts in reaching out to members recently, and one important initiative we undertook this year was our member survey, which was our first since 2006. The feedback we received from this was valuable and will be part of the foundation for the SMA as we build our strategic plan and enter into negotiations next year. SMA Communications Strategist Dallas Carpenter will give us the highlights of this survey after lunch today. We have heard from many of you as well over the past 2 months on the fall tour as Dr. Claire Kozrowski, myself, along with SMA staff, visited the regions to let you know some of the issues we were working on, but also more importantly to get feedback from you on issues that were affecting you and were important in your regions. We heard a number of issues raised, with many unique issues for each region. Among the common themes, we heard concerns about overhead costs, fee codes to compensate physicians for administrative work, and medical record storage. Other common issues brought up included questions about collaborative emergency care, the Saskatchewan Ministry of Health's quality agenda and lean training, and many were concerned that these programs were being implemented with little input from physicians and were unsure of how these things would impact on their practices. We have heard your concerns, and we have brought them up in discussion with Ministry health officials. While the SMA supports healthcare innovation, there needs to be extensive physician input in any program or initiative from the start, and we will continue to take that message back to the Ministry in future meetings. It is also important, however, that the Ministry and health regions hear straight from physicians and not just the SMA. The SMA is a strong and vital organization, but we are much stronger and will have more of an impact if there are many voices behind us supporting and driving innovation and future health care. The more physicians who reach out to administration and the Ministry of Health, the more likely our needs and the needs of our patients will be met. What our profession needs is more leaders to speak up and take on the challenge to shape our healthcare transformation and system. Taking on a leadership role, be that in your own practice, in your RMA, on an SMA committee or anywhere in the system, will ensure that you and your fellow physicians, and most importantly your patients, will be part of positive and beneficial change. I don't really need to say that to anyone here. If you weren't already taking a leadership role and volunteering your time to make sure physician voices were heard, you wouldn't be here. Unfortunately, the people in this room are becoming the exception. The trend today is less involvement in professional organizations, and in fact, this is a societal trend. Many organizations that we grew up with, such as Lions and Kiwanis clubs, are slowly fading away as interest, especially from younger generations, is simply not what it once was. There are a number of factors behind this, the biggest being busy lifestyles. In my time on the SMA board, I've talked to many members who are concerned about and have opinions on most of the issues we discuss at the board table, but many either don't have the time to attend their section or RMA meetings, or they aren't aware of the outlets that exist where they can express their concerns. Getting the younger generation involved is a challenge as well, and this will be only more daunting if we don't face it now. I believe some of the innovation to meet this challenge and encourage members to get involved can be embraced by means such as social media, communicating electronically, and by using meeting services such as telehealth to connect with our members and decreasing the amount of time spent away from home and traveling. More importantly, the SMA needs to communicate both through our communication vehicles but also through our individual members. Being a leader or being involved in professional and system improvements doesn't require sitting on a section executive or a committee at the SMA, although we do encourage you to participate in both of those things. Being a leader starts at the level of individual practice, improving how physicians operate and the service they deliver. Leadership includes self-assessment and making small changes that increase quality and accountability. These things make a difference for patients and encourage greater involvement in issues related to the profession. Leadership and innovation are linked. More often than not, physician leaders are the innovators. The SMA recognizes this, which is why we provide programs such as the Physician Management Institute and Practice Enhancement Program, while also administering the Continuing Medical Education Fund and the Saskatchewan EMR program, which we will receive an update on after lunch. We are developing leaders who embrace innovation. This is important as we align our priorities with the Government of Saskatchewan, which includes things like lean, clinical practice redesign, and the implementation of e-health. Innovation is also important as we head into negotiations. Physicians know we can't expect more for the same. Physicians know that we have to show we are aligned with the priorities of our funder and that we are doing our part to achieve efficiencies in the system if we wish to remain competitive with other provinces. We expect upcoming negotiations to focus on 3 areas, including quality, accountability, and working collaboratively, while we continue to seek competitive compensation and a strong support system for physicians and their families in an effort to attract physicians to Saskatchewan and keep our new graduates in the province. Our last contract accomplished a great deal, including the signing of the new Memorandum of Understanding in July. This agreement puts the SMA at the table for the signing of every physician contract. The negotiating process for both existing contracts and new contracts are outlined in the Memorandum of Understanding, while the process for dispute resolution and non-compensation and compensation-related disputes is also defined. Protecting and enhancing the well-being of physicians and their families is a big priority at the SMA. We do this in a number of ways, from the insurance products we offer to the services we offer through the Physician Health Program. We're very proud of our Physician Health Program and the work it does providing help for physicians, physicians in training, and their families who are struggling with physical, mental, personal, relational, and addiction issues. In 2011, 133 people accessed the program for assistance. Our program director, Brenda Sanger, does a great job, and the Physician Health Program has been one of our great successes. Dr. Alana Holt will be giving an update on this program after lunch. We have had many successful programs, and some of these we have outlined in our latest strategic plan highlights, which was published in the fall SMA News Digest. A few other highlights include the progress we're making in Saskatchewan as physician leaders. Of the 32 doctors who qualified as Canadian Certified Physician Executives from across Canada, 12 of them this spring were from Saskatchewan. Physicians are also stepping up to participate in the Saskatchewan Medical Association's in-house physician management, or PMI, courses this year. In the last year, 70 physicians have taken at least one PMI course. We are reviewing our current strategic plan, and we would like your feedback. Tomorrow, Dallas Carpenter will lead a review of the plan, and we'll be seeking the input of the delegates about our strategic priorities and our goals. This feedback will guide the board as we create the strategic plan for the next 3 years. Our next strategic plan has to reflect the need for physicians to lead the transformation of the system. Transformation is complex and demands on the SMA will be significant, meaning the organization and the staff must grow and move into new areas in order to keep up with the changing needs of our members. We will be focusing on areas such as physician well-being, recruitment and retention, contract negotiations, and building member services. We are looking forward to accommodate our membership and to ensure voices of Saskatchewan physicians are heard clearly and understood. This growth does come with cost, and as we respond to changes in technology, advancement in the healthcare system, and the ever-changing needs of our membership, we must be ready to accept those costs while remaining accountable to our members. Before I turn the floor back to Dr. Oleksinski, I would like to take a moment to thank SMA CEO Dr. Vino Padiachi and his staff for all the work they do throughout the year, and especially leading up to the RRA. They put in a lot of time and commitment working on these things. The efforts of the staff, our many committee members, our RA delegates, and the board of directors have made our association stronger than ever. Our members drive us to continually improve, ensure the patients they serve are the ones who ultimately benefit from our efforts. This morning we will have an opportunity to meet with Minister Dustin Duncan, who became the new Minister of Health this spring. This is his first visit to the RMA, so when he arrives, let's give him a warm welcome and continue our good working relationship with the Ministry of Health. Once again, welcome and thank you for attending the Representative Assembly. I hope you will enjoy these 2 days, and your input is extremely valuable in shaping and guiding the organization, allowing us to influence dialogue and demonstrate our commitment to the people of Saskatchewan. Thank you.